Hello guys, hi everyone. Join in if you can. If you are awake today, try and join in. Let's discuss something. Okay guys, hope you guys are doing well. Hope you all are doing well. How are you guys doing? Good evening, good morning, good afternoon, wherever you're watching me from. I hope all of you are doing well. Happy Christmas in advance. Happy holidays. So this is Dr. Rita on the microphone today. Yeah, Dr. Rita. So I'm here for us to discuss some things that a lot of people have been asking me on the internet. Some people sent me questions regarding prostate enlargements, prostate cancer screening, benign prostatic hypertrophy, prostate cancer itself, how to know that you have a problem with your prostate and things like that. So guys, today, before we dive into all those ones that I've already mentioned, we need to know what is prostatitis. When you say that prostate is enlarged, is inflamed, what is the term that we usually use? So in medical terms, we call it prostatitis. Yeah, so prostatitis means inflammation of the prostate gland or prostate region. Okay, and then how do you know that your prostate is enlarged? Your prostate is enlarged is being diagnosed or identified through blood test or through ultrasound of the prostate. Okay, so blood test that we usually do for that, we call it PSA, means prostatic specific antigen. So that is what measures the level of enlargement in your system, in your prostate region. Okay, it shows whether your prostate is normal, whether it's enlarged, whether it's benign, whether it's cancerous, or things like that. So what is the normal level for the prostate gland? So the normal level according to blood test is supposed to be anything from 0 to 4. Anything less than 4 is very normal and perfect. But sometimes some people have problems with their urination, and if you check their PSA level, it's very normal. But when you do the ultrasound, it shows like the prostate organ or region is inflamed, is enlarged. So that is the reason for doing the ultrasound. We don't usually do only the blood test. Sometimes, most times, we do the ultrasound as well, just to do a confirmatory test. That's what we call it, to make sure that the patient is good in all aspects. Okay, so anything 0 to 4, like I said, is very normal for your PSA level. Then anything from 4.1 to 9, we call it like BPH. B as in boy, P as in Paul, H as in hand or Henry. BPH means benign prostatic hypertrophy, and in other words, we can say benign prostatic enlargement. Some people call it like that. So that means it's not really cancerous. It hasn't gotten to the cancer level, but still is enlarged. And when you have that, okay, you need to really monitor your PSA level. You need to be on medication. You need to go to regular checkups just to make sure and monitor yourself to make sure you don't have like that cancer level. Okay, and then what is the cancer level? Anything above 9, from 9.1, some people will tell you anything below 10 or above 10, but everywhere I've worked at, and all the patients I've taken care of, and all the protocols in the different clinics and hospitals that I've been, what we do is anything above 9 now is cancerous stage or level, and that's, you really need to critically refer the patient to urologists and also put the patient on medication. Okay, what are the medications that we normally use to treat anything about prostate enlargement or prostate inflammation or anything that hasn't gotten to the cancer level? What medications do we use? So we have 2 different medications basically that we use for that. First of all, we use medication that we call the Flomax. Okay, that Flomax is usually 0.4 milligram that we give to the patients. They take it once a day for like anything from 3 months and above 3 months. But another thing is this: if the patient's level is not really is higher than, let's say, has gotten up to 5 or 6 or something like that, sometimes you can tell the patient to take the tablet instead of once a day. You can tell them to take it like twice a day, morning and night. Or for some patients, we usually put them on 0.8 milligram, okay, for them to take that once a day as well. So another medication that we use for prostate enlargement and issues like that, we call it the finasteride. Finasteride, here in America, you can give patient from 5 milligram to 10 milligram once a day for 3 months, 6 months, 9 months, whatever duration that you think that can help the patient control the prostate inflammation or enlargement in their system. And what is the essence of giving these medications? The essence of using these medications is to shrink the prostate, okay? So the prostate tends to shrink as you take the medications. So that is the essence of using these medications, because they will go to the cells and whatever surrounds the prostate, try to shrink everything down and make sure that the prostate patient is able to urinate very well, okay? Signs and symptoms of prostate enlargement. Number 1, you can have like hematuria. Hematuria means blood in your urine. Blood in your urine sometimes can be sign of urine infection, but sometimes it's not urine infection. A lot of people will go and be taking antibiotics and say, oh, my doctor gave me antibiotics, they said I have infection, but still the blood in your urine persists after taking the medication. So when that happens, you need to make sure that your doctor do some certain tests to know if actually you have infection or something. Okay? Sorry guys, hold on. Okay guys, sorry about that. We have a lot of patients here today and my nurses are running helter-skelter. Okay, so what I was saying is that some people have blood in their urine when they urinate, and most times we doctors or medical providers, we give them antibiotics after we do the urine test and see that they have blood in their urine. We think, oh, maybe it's kidney stone, or maybe it's urine infection, and you start treating it as one, as either urine infection or kidney stones. But you need to really pay attention towards what your patient is complaining. You need to listen to your patient, pay attention to the signs and symptoms of what they have. Some of the patients, when they pee, they are not able to empty their bladder, especially all these prostate patients, okay? They are not able to empty their bladder. So when patient tells you that, oh, I'm urinating, and when I urinate, it bridges. The urine doesn't come out straight. Rather, it comes out and then it stops. It comes out again and it stops. Or sometimes they're not able to empty their bladder, and that makes them to have like frequency urination, okay? Going to the restroom more often. Then you need to pay attention. That's when you bring up the PSA level, that you need to check it, and then do the ultrasound. You can do ultrasound of the bladder, of the pelvic, whatever that you know that can show you the prostate. Or, pelvic or abdominal/pelvic region, you do the ultrasound. That's going to show you how much the prostate and the reproductive organs, whether anything is going on with those organs in the body, okay? So when you check that and it seems to be normal and the patient is still having blood in the urine, if the PSA level is elevated, start patient on medication immediately and refer patient to urologist, okay? Urologist is the specialist that deals with the male reproductive organs, okay? So when you send patient to urologists have a way of doing further testing. They do different kinds of tests to make sure that the patient is, everything is good with the patient, yeah. That is the essence of doing the PSA level and the prostate ultrasound as well. Okay, how often do you need to screen for prostate cancer? How often do you need to do the blood test or the ultrasound or anything? How do you do your screening? And here in America, where I am right now, we recommend that any male or any man that is above 40, from age of 40 and above, you need to check your PSA level once every year. Okay, so once every year, if there is any sort of enlargement or abnormality, then we can do the ultrasound, or vice versa, like I said. But it has to be once every year from the age of 40 for you to be sure that you are good down there. Because a lot of people don't even go for their screening. They don't even know what screening of prostate enlargement or prostate cancer screening means. So they just stay there until the whole thing gets out of hand. And then when it gets out of hand, now it's reaching the cancer level, the doctors are going to tell you you need to go to general surgery, because general surgery will be the one, the urologist will refer you to the surgeon or urology surgeons. Okay, they will be the ones to like do the surgery, remove the prostate, and start you on either radiation or chemotherapy most times. Yeah, so please guys, manage your health, go for your annual screening, go to your doctor if you have any problem. Some people have fertility problems. They don't know that the prostate can be a cause of that as well, because this prostate is an organ that is found under your bladder. Okay, and what is the work of the prostate in male reproductive system? The prostate produces the seminal fluid, and the seminal fluid helps to push the semen from the prostate to the urethra, and from the urethra it goes through ejaculation to the vaginal region. So you can see that prostate has a lot of work to do in terms of fertility. And if you have problem with your prostate, men, you might not be able to pregnant a woman, because that is a vital organ that you need for your fertility as well. So please guys, go for your annual screening, go talk to your doctor, go do your annual test, go anything you can do to protect yourself, prevent health issues, check yourself out for early detection and treatment is better. That is why we recommend annual screening, so that if you have any problem, it's gonna be detected early and treatment can commence. But if you have it to like reach stage 1, stage 2, stage 3, everything is messed up at that time. And what we do is like management, and most times people don't recover very well from those things. Okay, bye guys, I'm at work right now. I just want to give you a quick one, okay, to make sure that you guys are doing the right thing. For my followers or clients, what will I call you guys, followers or clients that sent me messages, I hope this my little information that I'm giving out to you guys today answered your questions. So if you have any other question, don't hesitate to like send it to me as usual, and then we can talk about it, we can work on it together. If you have anybody that is having any problem and they don't know what to do health wise, please reach out to me. I am here 24/7 to answer your health questions, to help, to tell you the kind of medication, what kind of tests you need to do, the kind of treatment that you need to do, you need to take in order to make sure that the patient's outcome or your outcome / prognosis is good. Okay guys, drink your water like I usually tell you guys to do. Go for your annual screening, go do your regular checkup. Okay, bye, talk to you guys later. Bye guys, peace out.